Hello, everyone. My name is Mace, and I'm a volunteer with SHINE, which is an acronym for Servicing Health Insurance Needs of Elders. And on behalf of myself, SHINE, Elder Source, and the Department of Elder Affairs, we welcome you to today's presentation of Medicare Part D prescription drug coverage. Online meeting etiquette. Please familiarize yourself with the Zoom menu options. Please hold any questions, and with time permitting, I'll be glad to answer them for you at the end of the presentation. Elder Affairs. SHINE is a program of the Florida Department of Elder Affairs, DOEA. The SHINE program is part of the nationwide State Health Insurance Assistance Programs, SHIP. There are SHIP programs in all 50 states and 4 U.S. territories. The Florida Department of Elder Affairs receives annual funding for the SHINE program from a federal SHIP grant. The Florida Department of Elder Affairs vision is for all Floridians to live well and age well. SHINE's mission is to provide free and unbiased health insurance counseling through a dedicated network of volunteers, empowering Florida seniors to make informed healthcare choices. Disclaimer. SHINE is a free program offered by the Florida Department of Elder Affairs in partnership with your local Aging and Disability Resource Center. Specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. SHINE services are free, unbiased, and confidential. SHINE is not affiliated with and does not endorse any insurance company or product. Area Agency on Aging, AAA. The Department of Elder Affairs administers programs and services for elders through contract agreements with the 11 Areas Agencies on Aging, AAA, in Florida. The AAAs are independent, not-for-profit organizations responsible for ensuring the availability of services to all elders in Florida. The SHINE program contracts annually with the Aging and Disability Resource Centers to provide counseling services locally. SHINE counselors. The primary duty of volunteer SHINE counselors is to help Florida seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance, Medigap, low-income subsidy, extra help for prescription drugs, Medicare savings programs. SHINE counselors also provide counseling for long-term care planning and assist clients with Medicare complaints and appeals. Through the SMP grant, SHINE counselors can provide education on Medicare fraud and abuse, including how to prevent yourself from fraud, how to detect fraud, and how to report fraud. Medicare Part D topics. Presented here are some of the Part D topics. Brief Medicare review. Medicare review. What is Medicare? Medicare is a federal hospitalization, medical, and prescription drug insurance program. Unlike many other types of health insurance programs, Medicare benefits cannot extend to a spouse or other dependent. All eligible beneficiaries must be enrolled individually if they want Medicare coverage. Medicare was created by Congress in 1965 as Title 18 of the Social Security Act under President Lyndon Johnson. Medicare became effective July 1st, 1966. Medicare is the nation's largest health insurance program covering nearly 50 million Americans. There are roughly 4 million Medicare beneficiaries in Florida. While Medicare is administered by the Centers for Medicare and Medicaid Services, CMS, the Social Security Administration, SSA, is responsible for enrolling most beneficiaries into Medicare. The Railroad Retirement Board, RRB, is responsible for enrolling railroad retirees into Medicare. Medicare review. Parts of Medicare. Medicare has the following parts. Part A helps pay for the inpatient hospital stays and helps cover eligible skilled nursing care, home health care, and hospice care. Part B helps cover medically necessary services like doctor visits and outpatient care. Part B also covers some preventive services, including screening tests and shots, diagnostic tests, some therapies, and durable medical equipment like wheelchairs and walkers. Part C is another way to get your Medicare benefits. It provides Part A and B coverage and often Part D, prescription drug coverage. Medicare Advantage plans are managed by private insurance companies approved by Medicare. These plans must cover medically necessary services. However, plans can charge different copayments, coinsurance, or deductibles for these services. Part D, Medicare drug coverage, helps pay for outpatient prescription drugs. What is Medicare Part D? Medicare Part D, prescription drug coverage. What is Medicare Part D? Medicare Part D is a voluntary insurance program enacted in 2003 to provide prescription drug coverage for millions of Americans aged 65 and older who qualify for Medicare. The drug benefit became effective on January 1st, 2006. When Medicare was first enacted in 1965, it did not provide prescription drug coverage. In 2002, the Congressional Conference Committee noted that 25% of seniors had no insurance to cover drugs. There are two ways to get Medicare prescription drug coverage. Medicare prescription drug plans. These plans, sometimes called PDPs, add drug coverage to original Medicare. Some Medicare cost plans, some private fee-for-service plans, and medical savings account plans. Medicare Advantage plans, like an HMO or PPO, you get all of your Part A and Part B coverage and prescription drug coverage, Part D, through these plans. Medicare Advantage plans with prescription drug coverage are sometimes called MA-PDs. You must have both Part A and Part B to join a Medicare Advantage plan. Both types of plans are called Medicare drug plans. In either case, you must live in the service area of the Medicare drug plan you want to join. Medicare Part D, prescription drug coverage. Part D covers. Medicare drug plans cover generic and brand name drugs. To be covered by Medicare, a drug must be available only by prescription, approved by the Food and Drug Administration, FDA, used and sold in the United States, and used for a medically accepted indication. Covered drugs include prescription drugs, biological products, and insulin. Medical supplies associated with the injection of insulin, such as syringes, needles, alcohol swabs, and gauze, may also be covered under Part D. New insulin benefit. Cost of a 1-month supply of each Part D covered insulin is capped at $35 without a deductible. For a 60 or 90-day supply of insulin, your cost can't be more than $35 for each month's supply of each covered insulin. For example, if you get a 3-month supply of insulin, your cost cannot be more than $105, $35 for each month's supply. CMS has also clarified that supplies associated with the inhalation of insulin may be covered by Part D plans. Part D will cover all commercially available vaccines when they're reasonable and necessary to prevent illness, except those covered by Part B. Part B vaccines include flu, pneumonia, hepatitis B, COVID-19, and the necessary vaccines to treat an injury or exposure to a disease. Medicare Part D, prescription drug coverage. Part D does not include drugs for the following conditions or following types of drugs are excluded by law from Medicare prescription drug coverage: anorexia, weight loss or weight gain, fertility, cosmetic or lifestyle purposes, e.g. hair growth, symptomatic relief of coughs and colds, erectile dysfunction, drugs not approved by the FDA, prescription vitamins and minerals, and non-prescription over-the-counter drugs like Tylenol. However, plans may choose to cover these at their own cost or share the cost with their members. Who can get Part D and when? There are several important things to keep in mind. Who is eligible? All beneficiaries with Medicare are eligible to enroll in a Medicare drug plan. Beneficiaries who live outside the U.S. or who are incarcerated are not eligible to enroll in a plan and therefore cannot get this coverage. Beneficiaries must be enrolled in a plan to get Medicare drug coverage. This coverage is not automatic like A and B. How is coverage provided? Medicare drug plans are offered by insurance companies approved by Medicare, but beneficiaries must enroll themselves as it is not automatic. There are two types of Medicare Part D plans: PDP, standalone prescription drug plans, add coverage to original Medicare and some other types of Medicare plans. MA-PD. Most Medicare Advantage plans, like an HMO or PPO, include prescription drug coverage. What should beneficiaries consider when selecting a Part D plan? Coverage. All drug plans have a formulary or a list of drugs that they cover. It's important to know what they cover and if it includes the drugs a beneficiary needs. Cost. Plans may include premiums, deductibles, co-payments, or co-insurance, and each plan can have different coverage gaps. Convenience. How does it work with your other plans and benefits? Customer service. Does this plan offer the type of customer service you are looking for? Financial. Extra help is available. Extra help or the Low Income Subsidy, LIS, is a federally funded program available to beneficiaries who qualify to help save on the cost of drugs. It is based on an individual's income and assets. The term Medicare drug plans is used throughout this presentation to mean both Medicare prescription drug plans and Medicare Advantage plans with prescription drug coverage. Joining and changing plans. The initial enrollment period for Medicare surrounds a beneficiary's 65th birthday, and coverage is effective based on when you enroll. Enroll within 3 months prior to the 65th birth month, effective at the start of the 65th birth month. Enroll during 65th birth month, effective start of the following month. Enroll 1, 2, or 3 months after the 65th birth month, effective start of the following month. The best time to enroll is during the 3 months before turning age 65. Joining and changing plans. There is an open enrollment period, OEP, sometimes called the annual open enrollment. This OEP is October 15th through December the 7th each year. During the OEP, beneficiaries can join, change, or drop prescription drug coverage. The change will be effective January 1st of the following year. There are special situations that give a person a special enrollment period, SEP, such as a permanent move out of a plan's service area, being eligible for financial assistance, or moving into, residing in, or leaving a long-term care facility like a nursing home. The time period of the SEP depends on the reason for the special enrollment period. Enrollment periods give a person the opportunity to join, switch, or drop Medicare drug plans. Those who qualify for financial assistance can only change plans one time per calendar quarter for the first 3 quarters of the year. We will talk more about financial assistance in a few minutes. How much does Part D cost? Medicare drug plan cost. Costs vary depending on the plan. Plans must provide a standard minimum level of coverage. Plans may offer more coverage and/or additional drugs, generally at a higher monthly premium. The actual coverage and cost of the Medicare drug plans can be found at medicare.gov or by calling a Shine counselor. For coverage in 2025, beneficiaries will generally pay a monthly premium, which varies by plan. Some plans have 0 premiums. Others have higher premiums, but might offer more coverage. Most plans fall between $30 and $60 per month. The annual deductible is the amount plan members must pay for prescriptions each year before the plan starts to pay. These amounts can change every year. Some plans offer a 0 deductible, usually for a higher premium. No plan can have a deductible higher than the standard amount. Co-payments or co-insurance. This is the amount plan members must pay for each prescription after meeting the deductible, if any. In some plans, the co-payment, a set amount, or co-insurance, a percentage of the cost, is the same for any prescription. All plans must assign a tier for each drug on their formulary. Initial coverage begins once the deductible is met. The plan pays 75%, while the beneficiary pays 25%. The beneficiary pays 25% for generic drugs and 25% for brand drugs. Once a beneficiary reaches the dollar amount shown in out-of-pocket drug costs, they do not have to pay anything for the remainder of the calendar year. The amount beneficiaries pay in some plans may vary depending on how much they have spent. Under the standard benefit, once the deductible is met, members pay 25% coinsurance until they reach the coverage gap. The amount beneficiaries pay in some plans may vary depending on how much they have spent that year. (2025) prescription drug coverage. Medicare prescription drug coverage is divided into 3 phases. 1. Deductible. Beneficiary pays 100% of drug cost until the deductible is met. The deductible may be zero. It cannot exceed the standard amount shown. Begins January 1st. 2. Initial coverage. Beneficiary pays a coinsurance, 25% is standard, and the plan pays the remaining balance. Begins when beneficiary's drug costs reach the deductible amount. The plan pays up to 75% in this phase. 3. Catastrophic coverage. Begins when beneficiaries' out-of-pocket costs reach the amount shown. Includes manufacturer discounts on drugs. The beneficiary pays a 0% coinsurance for generics and brand name drugs or a small copayment, whichever is greater. The drug plan is liable for 20% of the cost. In a standard drug plan, Medicare subsidizes 80% of the costs for catastrophic coverage. This is called the reinsurance subsidy. Note: coverage percentages may differ for individual beneficiaries and plans. New 2025 enrollees who need expensive medications should also be aware of the new option starting in 2025 to spread out their drug cost in equal payments throughout the year instead of having to meet the $2,000 out-of-pocket maximum in the first few months of the year. Late enrollment penalty. Individuals who do not join a Medicare drug plan during their initial enrollment period may have to pay a premium penalty for every month they wait to enroll, unless they have other prescription drug coverage that meets Medicare's minimum standards, called creditable coverage. To avoid a penalty, a beneficiary must not go for a period of 63 consecutive days or more without creditable prescription drug coverage. The penalty is added to the premium payment amount. It is calculated by multiplying 1% of the national base beneficiary premium by the number of full months the person was eligible but not enrolled in a plan and did not have other creditable drug coverage. People with this penalty will have to pay it as long as they have Medicare prescription drug coverage. People receiving extra help, LIS, pay no penalty. Comparing and choosing a Medicare drug plan. Choosing a Medicare RX drug plan. Plans can be flexible in their benefit design, but it must offer at least the standard benefit. Most plans offer coverage above the defined standard benefit, e.g., no or low deductible, and co-pays instead of co-insurance. To keep costs lower, many plans place drugs into different tiers, which have different copayment amounts. Each plan can form its tiers in different ways. In some plans, people can often save money by choosing a generic drug instead of the brand name drug. Enhanced plans may even offer coverage of drugs that are specifically excluded from Part D. These plans can also include the reduction of the defined standard deductible or the reduction of cost sharing in the initial coverage phase. All plans must cover the same categories of drugs, but plans may choose what specific drugs to cover in each category. Generally, not all Part D drugs are covered by every plan. Virtually all plans have a formulary or list of covered drugs. Plans formularies must include a range of drugs in each prescribed category to make sure people with different medical conditions can get the treatment they need. A plan's formulary may not include every drug a person takes. However, in most cases, a similar drug that is safe and effective will be available. Also, benefits and costs may change from year to year. Beneficiaries enrolled in a plan will receive an annual notice of change letter that explains any changes that have been made to cost and coverage for the next year. Choosing a Medicare RX drug plan. There are 4 steps individuals may take to choose a Medicare drug plan. Step 1. Collect information about their current health and prescription drug coverage, as well as their current and anticipated needs. Does their current health and drug insurance coordinate with Medicare? Is it creditable to Medicare? Step 2. Prepare a list of the prescription drugs they currently take, including the dosages, quantities, how often they purchase them, and from where. Are there any other less expensive alternatives? Do they have any credible drug insurance options like VA benefits or retiree insurance plans? Step 3. Compare Medicare drug plans. Check for plans that cover the prescriptions they take, and that includes the pharmacies that they prefer. Anyone can use Plan Finder at medicare.gov to get personalized information about available plans that might meet their needs. Step 4. When they find a plan that they like, they can enroll online with the Plan Finder or by calling 800 Medicare or the plan sponsor directly. It's a good idea to double check the plan's website and or talk to a plan representative if there are any special questions or concerns. Anyone reviewing their plan options can contact Shine for assistance, and our volunteers will help them navigate Medicare.gov. Medicare.gov. Medicare Plan Finder. The Medicare.gov Plan Finder allows anyone to search and compare available Medicare plans in their area based on the entry of general information, zip code, or with a personal account. When logged in, There are online chat guides to help with questions or seek a Shine counselor to help with the plan comparisons. Financial assistance. Shine Financial Assistance for Medicare Beneficiaries handout. Here is an example of the financial assistance for Medicare beneficiaries handout that can be obtained by calling your local Shine office. We will discuss two cost savings programs known as Medicare Savings Programs and the Extra Help Program. Financial assistance programs. Financial assistance programs for people with Medicare include Medicare savings programs for help with certain original Medicare Part A and Part B expenses only. Extra help, low income subsidy for help with prescription drug costs under Part D. Medically needy program for help with medical expenses for a given month once a person meets their share of cost. A possible option for people with high medical expenses and incomes that exceed the limits of other programs. Medicaid. Various programs that offer medical assistance to people who qualify. Financial assistance eligibility. What specifically qualifies as income and assets resources can vary based on the individual program. However, they generally include income, wages earned, gross, Social Security, SSA benefits, supplemental security income, SSI, Veterans Administration, VA benefits, temporary assistance for needy families, TANF benefits, disability payments, retirement pension, interest, dividend income, rental property income, estate trust fund income, alimony, regular contributions from another person. Assets, resource, real property or other than homestead, primary residence, vehicles other than a primary car, bank accounts, certificates of deposits, money market funds, stocks and bonds, trust accounts, life insurance policies above specified limits. Financial assistance, Medicare savings programs, MSP. The Medicare savings programs are part of the National Medicare program and are designed to help beneficiaries with an income that does not exceed 135% of the federal poverty level. Asset limits also apply. The federal poverty limit, FPL, can change every year. The QMB, SLMB, QI, and QDWI programs are collectively known as the Medicare Savings Programs, MSP. Qualified individual QI pays Part B premium. Special Low Income Medicare Beneficiaries, SLMB, pays Part B premium. Qualified Medicare Beneficiary, QMB, pays Part B premium, A if applicable, auto-enrolled in Extra Help, LIS for Part D coverage. Qualified Disabled and Working Individual, QDWI, for beneficiaries that are under 65, have a disability, and are not eligible for Medicaid. Financial assistance, extra help, or low income subsidy, LIS. Depending on a person's gross monthly income and assets, resources may be eligible for assistance with Part B premiums, deductibles, coinsurance, and other costs. They also will not be required to pay a Part D late enrollment penalty while receiving extra help. Who qualifies automatically will receive a notice in the mail. Those with full Medicaid coverage, those enrolled in a Medicare Savings Program, those who receive SSI. You can apply at secure.ssa.gov/I1020/start. The 2025 income and resource limits changes every year. An individual income limit is $22,590. Resource limit $16,100. A married couple income limit $30,660. Resource limit $32,130. 2025 out-of-pocket costs with extra help changes every year. Plan premium is $0. Plan deductible is $0. Prescriptions up to $4.90 for generics and up to $12.15 for brand name drugs. Once beneficiaries reach $2,000 in total drug cost, they pay $0 for each covered drug. Financial assistance programs, medically needy program, and Medicaid. Financial assistance, other ways to save. Patient assistance programs are not mandated by Medicare or any law. They are offered at the discretion of the pharmaceutical companies. The benefits and eligibility of the individual programs vary. Some have restrictions against people with insurance, Medicare, and or income and assets limits. Nearly all major pharmaceutical companies offer a PAP. There are several ways to find prescription assistance programs, including specific websites such as Needy Meds, the Partner for Prescription Assistance, RX Assist, individual pharmaceutical company websites, individual retailers' websites. You may also find some assistance programs using internet search engines such as Google. Be aware of private savings programs that charge a fee and always be cautious when divulging personal, financial, and medical information. Medicare fraud and abuse. Medicare fraud and abuse. The difference between fraud and abuse is intent. Medicare fraud and abuse. Prevent, detect, report. Prevention. Scam artists use Medicare numbers to bill for services and equipment that you did not receive or need. Some tips to protect yourself from healthcare fraud. Treat your Medicare card like you would a credit card. Only share Medicare cards and numbers with trusted sources who need that information to serve you, i.e., doctors and pharmacies. Do not rely on advice or offers from unknown persons who call, visit, or approach you in public. Never sign a blank medical or insurance form. Detect. Medicare sends you 2 notices with your claim information. The 2 notices are the following: Medicare Summary Notice, MSN, and Explanation of Benefits, EOB. These notices allow you to review your Medicare claims and check for possible mistakes. Report. If you see something unusual on your MSN, check with your plan or call Shine. If you get a call from someone requesting your Medicare number, do not give it out. Call the Federal Trade Commission at 877-382-4357 and your local law enforcement. If you believe you are a victim of fraud or abuse, contact your local law enforcement and Shine for more information. Prevent. Medicare loses $60 billion each year due to fraud, errors, and abuse. CMS developed a new Medicare card in 2018 that removed Social Security numbers, and all beneficiaries receive new cards by mail. Scamming scenarios. Scammers use Medicare numbers to bill for services and equipment you didn't receive or need. Scammers call or approach you in public asking for your personal information. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card as you would a credit card. Share Medicare cards and numbers only with trusted sources who need that information to provide services to you, i.e., doctors, pharmacies. Keep your address up to date. Verify people who call asking for personal information. Don't rely on advice or offers from strangers who call, visit, or approach you in public. Never sign blank medical or insurance forms. Detect. There are two notifications you can receive from Medicare that should be reviewed to verify that they do not have errors. Medicare Summary Notice, MSN, and Explanation of Benefits, EOB. Your MSN is sent by Medicare every 3 months. You may choose to receive Medicare summary notices electronically, e-MSNs. If you choose this option, you will receive a monthly email with a link to your claims information. Your prescription drug plan and/or your Medicare Advantage plan is required to send you monthly EOBs. Red flags on an MSN. Your Medicare Summary Notice, or MSN, is very useful for detecting fraud. Let's review the 5 highlighted sections that will help you check for fraudulent Medicare charges. 1. Your visit. This section provides information like the date you went to your doctor. Keep your bills and compare them to your notice to be sure you got all the services listed. 2. Service descriptions. User-friendly service descriptions will make it easier for you to know what you were treated for. 3. Approved column. This column lets you know if your claim was approved or denied. 4. Max you may be billed. This is the total amount the provider is able to bill you. It's highlighted and in bold for easy reading. 5. Notes. This section refers to explanations of your service as listed at the bottom of the page. Next, let's look at the sections highlighted in red for examples of what to specifically check for. Is this a provider you know? Did you receive services on this day? If you live in Connecticut, did you really receive services in Ohio? Do any services appear twice when they shouldn't? Report. Medicare loses $60 billion each year due to fraud, errors, and abuse. CMS developed a new Medicare card in 2018 that removed Social Security numbers, and all beneficiaries receive new cards by mail. Scamming scenarios. Scammers use Medicare numbers to bill for services and equipment you didn't receive or need. Scammers can call or approach you in public asking for your personal information. Here are some tips to protect yourself from healthcare fraud. Treat your Medicare card as you would a credit card. Share Medicare cards and numbers only with trusted resources who need that information to provide services to you, i.e. doctors and pharmacies. Keep your address up to date. Verify people who call asking for personal information. Don't rely on advice or offers from strangers who call, visit, or approach you in public. Never sign blank medical or insurance forms. Questions or comments? Please hold any questions or comments until the end of the presentation, and with time permitting, I'll be glad to answer them for you. Shine. Shine counselors offer free and unbiased assistance to help seniors identify, understand, compare, and/or enroll in Original Medicare, Medicare Advantage plans, Medicare prescription drug coverage, Medicare supplement insurance policies, Medigap, Medicare prescription drug low-income subsidy, Extra Help, Medicare savings programs, long-term care planning, insurance and financing, other public and private health insurance. Contact the local Shine program. Elder Source. The local PSA 4 Shine contact in Jacksonville, Florida is Elder Source, located at 10688 Old St. Augustine Road in Jacksonville, Florida 32257. The phone number is 888-242-4464. Tell us how we are doing. Please complete a short survey at the URL listed here, tinyurl.com/survey for Shine, and tell us how we are doing. End of presentation. Lastly, on behalf of myself, Shine, Elder Source, and the Department of Elder Affairs, we appreciate your time and participation in today's presentation. We hope that this presentation has provided an insight into becoming further educated and assisting you with your Medicare endeavors. Thank you.